Hi, this is Ashwini. Welcome back to my Adunya Nursing Classes YouTube channel. Today in this video, I am going to tell about physiological changes during pregnancy. During pregnancy, there is progressive anatomical, physiological and biochemical changes will occur and also to all systems of the body. This is because increasing demands of the growing fetus. Let us discuss one by one. During gestation, there are so many changes will occur. Some of the changes are changes in genital organs, breast changes, cutaneous changes, hematological changes, metabolic changes, cardiovascular changes, and systemic changes. Now we will see one by one. Let us know about the physiological changes that occur in the genital organs. In this slide, you can see here the various parts of the female genital organs, that is vulva, vagina, uterus, isthmus, cervix, fallopian tube and ovary. So, physiological changes takes place in these various parts of the female genital organs. Vulva. The vulva becomes oedematous and more vascular. Labia minora pigmented and hypertrophied, and superficial varicosities may appear especially in multiple. Next, coming to the vagina. Vaginal walls become hypertrophied, oedematous and more vascular. And in this, increased blood supply of the venous plexus surrounding the walls gives the bluish coloration of the mucosa, which is called as Jacquemer signs. And the length of the anterior vaginal wall is increased. The secretion becomes copious, thin and curdy white due to marked exfoliated cells and bacteria. The pH becomes acidic, means 3.5 to 6. Next, coming to the uterus, there is enormous growth of the uterus during pregnancy. The uterus, which in non-pregnant state weighs about 60 grams with a cavity of 5 to 10 ml and measures about 7.5 centimeter in length. At a turn, weighs 900 to 1000 grams and measures 35 centimeter in length. The capacity is increased by 500 to 1000 times. Changes occur in all the parts of the uterus, means body, isthmus and cervix. Coming to the muscles, changes in the muscles. Hypertrophy and hyperplasia occur under the influence of the hormones and estrogen progesterone. Coming to the stretching of the uterus, the muscle fibers further elongate beyond 20 weeks due to the distension by the growing fetus. The wall becomes thinner and at term measures about 1.5 centimeter or less. The uterus feels soft and elastic, in contrast to firm feel of the non-gravid uterus. Arrangement of the muscle fibers. There are three distinct layers of muscle fibers are there: outer longitudinal, inner circular and intermediate. First one, outer longitudinal. It follows a hood-like arrangement over the fundus. Some fibers are continuous with the round ligament. Second, inner circular. It is scanty and sphincter-like arrangement around the tubal orifices and internal OS. Next, coming to the third one, intermediate. It is the thickest and strongest layer arranged in crisscross fashion through which the blood vessels run. In last slide, we have seen that changes in the muscle fibers and arrangement of the muscle fibers. Now, in this slide, we will discuss about shape of uterus. Means in this, you can see this three pictures clearly, that is in first trimester, second trimester and third trimester. We can see that in early pregnancy, the uterus is enlarging, but it is within the pelvis. In second trimester, the uterus is enlarging, is lifted out of the pelvis. Means in this condition, micturition is normal. In third trimester, the uterus is enlarging completely and the head of the fetus descends into the pelvis. We can see this. And what about the shape of the uterus? In non-pregnant state, pyriform shape is maintained by early months. It becomes globular at 12 weeks. As the uterus enlarges, the shape once more becomes pyriform or ovoid by 28 weeks. It changes to spherical beyond 36 weeks. Next, coming to the position of the uterus. Normal anteverted positions exaggerated up to 8 weeks. The enlarged uterus may lie on the bladder. Next, Braxton Hicks. The uterine contractions is in pregnancy has been named after Braxton Hicks, who first described its entity during pregnancy. The contractions are irregular, infrequent, spasmodic, and painless without any effect on the dilatation of the cervix. It is called as Braxton Hicks. Isthmus. There are important structural and functional changes in the isthmus during pregnancy. During the first trimester, isthmus hypertrophies and elongates to about 3 times its original length. It becomes softer. You can see this in this picture. The elongation and formation of the lower uterine segment at 8 weeks, 12 weeks, and 16 weeks. Cervix. There are hypertrophy and hyperplasia of the elastic and connective tissues. Vascularity is increased, especially beneath the squamous epithelium of the portio vaginalis, which is responsible for its bluish coloration. All these lead to marked softening of the uterus, which is called as Goodell sign. Secretion is becomes copious and tenacious physiological secretion of pregnancy. This is due to the effect of progesterone. The length of the cervix remains unaltered but becomes bulky. Next, coming to the fallopian tube. There are the total length is fallopian tube somewhat increased. The tube become congested. Muscles undergo hypertrophy. Ovary. The growth and function of the corpus luteum reaches its maximum at 8th week when it measures about 2.5 cm and becomes cystic. It looks bright orange, later on becomes yellow and finally pale. Hormones. Estrogen and progesterone secreted by the corpus luteum maintain the environment of the growing ovum before the action is taken over by the placenta. Control the formation and maintenance of decidua of pregnancy due to high hormonal stimulation. Inhibit ripening of the follicles. Lastly, we have discussed regarding changes in the genital organs in detail. Now coming to the second part, breast changes. In primigravida, the changes in the breasts are best evident. In multipara, who has once lactated, the changes are not clearly visible. Next, size. Size of the breasts are increased. This is due to marked hypertrophy and proliferation of the ducts. Vascularity is increased, which results in appearance of bluish veins running under the skin. Nipples and areola. The nipples become larger, erectile, and deeply pigmented. Variable number of sebaceous glands, which remain invisible in the non-pregnant state in the areola, become hypertrophied and are called Montgomery tubercles. The outer zone of the less marked and irregular pigmented area appears in second trimester and is called secondary areola. And coming to the secretion can be squeezed out of the breast at about 12th week, which at first becomes sticky. The demonstration of secretion from the breast of a woman who has never lactated is an important sign of pregnancy during primigravida. Now come to the third changes, that is cutaneous changes. You can see in this slide there are three pictures are there. First one is face, second one on the abdomen there is a linea nigra and stria gravidarum. On the face it is an extreme form of pigmentation around the cheek, forehead and around the eyes. This disappears spontaneously after delivery. Next, on the abdomen, you see first linea nigra, a bluish black pigmented in the midline stretching form of the sternum to the symphysis pubis. Means you can see in the abdomen there is a dark line will be there. This pigmented changes are probably due to melanocyte stimulating hormone. Next, come to the stria gravidarum. You see the stretch marks on the abdomen in the third picture, a slightly depressed linear marks with the varying length and breadth found in pregnancy. They are predominantly found in the abdominal wall, below the umbilicus, sometimes over the thighs and breasts. Hematological changes. During pregnancy, there is increased vascularity of the enlarging uterus with the interposition of uteroplacental circulation. The activities of all the systems are increased. Blood volume is markedly raised during pregnancy. The blood volume starts to increase from about 6th week and expands rapidly thereafter to maximum 40 to 50% above the non-pregnant level, at least 30 to 34 weeks. The level remains almost static till delivery. Plasma volume. It starts to increase by 6 weeks. The rate of increase almost parallels to that of blood volume, but the maximum is reached to the extent of 50%. Total plasma volume increases to the extent of 1.25 liters. The increase is greater in multigravida, in multiple pregnancy and with a large baby. Next, coming to the cardiovascular system. Due to elevation of the diaphragm consequent to the enlarged uterus, the heart is pushed upward and outward with slight rotation to left. Pulse rate is slightly raised, often with extra systoles. A systolic murmur may be audible in the apical or pulmonary area. This is due to decreased blood viscosity and torsion of the great vessels. A continuous hissing murmur may be audible over the tricuspid area in the left, second and third intercostal spaces called the mammary murmur. It is due to increased blood flow through the internal mammary vessels. Cardiac, cardiac output starts to increase from the 5th week of pregnancy and reaches its peak 40 to 50% at about 30 to 34 weeks. Thereafter, cardiac output remains static till term when the observation is made at lateral recumbent position. Diastolic BP decreases by 5 to 10 mm of Hg. Next, coming to the metabolic changes, in that carbohydrate metabolism. Increased amount of glucose from the mother to the fetus is needed throughout pregnancy. Insulin secretion is increased in response to glucose and amino acids. This mechanism ensures continuous supply of glucose to the fetus. Next, coming to the protein metabolism. There is positive nitrogenous balance throughout pregnancy. At term, the fetus and the placenta contain about 500 gram of protein, and the maternal gain is also about 500 grams, chiefly distributed in the uterus, breasts, and the maternal blood. Coming to the fat metabolism, an average of 3 to 4 kg of fat is stored during pregnancy, mostly in the abdominal wall, breasts, hips, and thighs. There is a last changes in physiological changes during pregnancy, that is systemic changes. In systemic changes, we will discuss that changes in respiratory system, changes in urinary system, changes in alimentary system, changes in skeletal system, and changes in nervous system. First, we will discuss that respiratory changes. Tidal volume increases by 30 to 40%. residual volume, total lung capacity, and functional residual capacities decreases, elevated diaphragm, and breathing becomes diaphragmatic. Next, coming to the urinary changes, kidney enlarges in size by 1 to 1.5 centimeter. GFR is increased by 50%. Frequency of micturition, uterus and urinary bladder vascularity will be increases. Coming to the elementary changes, the gums become congested and spongy and may bleed to touch. Muscle tone and motility of the entire gastrointestinal tract are diminished due to high progesterone level. Cardiac sphincter is relaxed and regurgitation of acid gastric content into the esophagus may produce chemical heartburn. Change, change in sense of taste. Alkaline phosphatase level is increased. Coming to the nervous changes. Some sorts of temperamental changes are found during pregnancy and in the puerperium. Nausea, vomiting, mental irritability, and sleep disorders are probably due to some psychological background. Postpartum blues, depression, or psychosis may develop in a susceptible individual. CTS. CTS means carpal tunnel syndrome. May appear in the later months of pregnancy. Paresthesia and sensory loss over the anterolateral aspect of the thigh may occur. It is due to compression of the lateral cutaneous nerve of the thigh. Coming to the skeletal changes. During pregnancy, there is increase in the demand of calcium by the growing fetus to the extent of 28 gram. There is increased mobility of the pelvic joints due to softening of the ligaments caused mainly by hormone. This along with increased lumbar lordosis during later months of pregnancy due to enlarged uterus produces backache and waddling gait. Next, coming to the last changes, that is endocrine changes. The endocrine glands play very important role in the physiological changes during pregnancy. Corpus luteum secretes about 40 mg of progesterone a day. Pituitary, thyroid, adrenal cortex, parathyroid, and pancreas is enlarged. Headache may occur due to enlargement of pituitary gland. BMR increases due to enlarged thyroid gland. FHS, LH are low due to increased estrogens and progesterone. Serum prolactin level increases. ACTH, GH increases while TSH, ADH remains unchanged. Serum iodine level falls, therefore increased requirement of iodine from 100 Ug to 200 Ug. Blood glucose level is increased in the second half.